Welcome to Everyday Nursing Knowledge Lectures, and today we will learn about cranial nerves. There are 12 pairs of cranial nerves and they are located in the back of our brain. The first two cranial nerves, that is olfactory and optic, they both arise from the cerebrum, whereas rest of the cranial nerve arise from the brainstem. So the cranial nerves are, first is olfactory, second optic, third oculomotor, fourth is trochlear, fifth is trigeminal, the blue one, and trigeminal is the largest cranial nerve. Six is abducens, seven is facial nerve, the green one, eight is vestibulocochlear, 9 glossopharyngeal, 10th is vagus nerve, this one, 11th is accessory nerve, and 12th is hypoglossal nerve. Now, to remember these cranial nerves in order, you can by heart the mnemonics. The mnemonics is O, 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 to touch and feel, very good velvet, ha, heaven. And see the first letter. O, olfactory, O, optic, O, oculomotor, T, trochlear, T, trigeminal, A, abducens, F, facial, V, vestibulocochlear, G, glossopharyngeal, V, vagus, A, accessory, and H, hypoglossal. Now let's see the functions of this cranial nerve. Olfactory, it helps with the smell. Remember, factory, smell. So olfactory helps with the smell. Optic means eyes. So optic nerve helps with vision. Oculomotor, again ocular related to eye and motor movement. So it helps with eye movements. There are three cranial nerves that helps with eye movement. That is 3, 4 and 6 cranial nerve. That is oculomotor, trochlear and abducens. These three cranial nerve helps with eye movements. Now the fifth cranial nerve, trigeminal, which is the largest cranial nerve, it helps with facial sensation and chewing. Sixth is abducens, that again helps with eye movement. Seventh is facial nerve, that helps with facial movement and taste. Bell's palsy is a condition in which this facial nerve is inflamed or swollen that causes paralysis of one side of the face. So facial nerve helps with facial movements and taste. Next is vestibulocochlear. Cochlear related to balance. So vestibulocochlear nerve helps with hearing and balance. Next is glossopharyngeal. The term glosso means related to tongue and pharynx means back of the throat. So glossopharyngeal helps with swallowing, taste and production of saliva. 10th nerve, that is the vagus nerve, it helps with breathing, heart rate and digestion. Accessory nerve, that helps with raised shoulders and movement of head and neck. The 12th nerve, hypoglossal, again glossal related to tongue. So the 12th cranial nerve, hypoglossal, helps with movement of tongue. Now to find whether these cranial nerves are motor, sensory, you can learn another mnemonics. Before going to this mnemonics, let's see what is sensory nerves. Sensory nerves are nerves that carry impulse or signals from the organs to the brain. And motor nerves are nerves that carry signals or impulse from brain to the organs. So the nerves can be either sensory, motor, or sometimes it can be both. It does both sensory and motor function. So to learn or to remember the cranial nerves, whether it's sensory or motor, you can by heart the mnemonics. The mnemonics is, some say marry money, but my brother says big brains matter most. And see the first letter. S stands for sensory, M stands for motor, and B stands for both. So the sensory nerves are olfactory, optic, and vestibulocochlear. That means it helps with the sensation. The sensation are smell, vision, and hearing. Now the motor nerves are helps with the movements. There are 5 motor nerves. The nerves that helps with eye movements. oculomotor, trochlear, abducens. These three helps with eye movement. So these three are motor nerves. Again, the last two, the accessory, it helps to raise shoulders and turn head and neck. It's a motor nerve. And hypoglossal, again, it's a movement, so movement of the tongue. So these two are also motor nerve. And the rest of the nerves are both. It does both function. That is trigeminal, again, facial sensation and moving, chewing. So it's both facial nerve, facial movement, it's movement, taste, sensation. So it's motor and sensory. Next to is glossopharyngeal, swallowing, taste sensation, swallowing. That's it. It is a movement. It has motor function too. Vagus nerve, again, it has both functions. So today we learned about cranial nerves, and thanks for watching my video.